What's up, everybody? Welcome back to The Pulse. This is Kayla, and today I'm happy to share tips for patients to enhance their experience and ease the process of visiting a medical professional. We'll talk about practical suggestions for doctors to improve communication, fostering a smoother and more effective medical encounter. Tune in for a prescription of knowledge to make your next doctor's visit a positive and constructive experience. Especially in the autistic community, you hear a lot of horror stories, like doctors just not respecting people because they're autistic and blaming everything on them being autistic, even when they're like, well, this is not normal for me. I know what's normal for me. And so I thought it would be a good thing to have some stories out there of the good experiences so that people know what they deserve to be getting from the healthcare system. And doctors who maybe aren't as experienced with working with neurodiverse individuals, um, if they hear this, then they will get a better idea of what things are actually really good to do when working with neurodiverse people.
Amazing. So, can you tell us about an experience you had that was positive with a healthcare professional?
Well, I have been very lucky with my family doctors. They've always been, well, I've had two now, and they were both really great at communicating, super clear, and I'm not always really good at putting words to how I'm feeling, but I could go in and talk to them and be like, yeah, my stomach feels off. And they could be like, okay, is it pain? Is it pain? Is it like you're nauseous? And they would give me a list of different things that could be going on with your stomach or whatever part that it was. And I could be like, yes, that one, that's the right one. And if it was pain, my doctor would be like, okay, here's a list of different types of pain. Can you identify from this list what type of pain it is? And I found that super helpful. And the my current family doctor, um, who my brother is also with, he's also, because my brother has Down syndrome, and he has an even harder time communicating these things, but he's really good at my mom will bring my brother in and be like, yeah, he's sick, but he can't tell us what's going on. And we don't know the questions to ask because we're not doctors. And he'll ask every question under the sun to my brother until he can identify what's going on and actually communicate with my brother instead of just communicating with my mom like some doctors will do. Because I've been to a lot of ear, nose, and throat specialist appointments with them, and they'll communicate with my mom instead of my brother. But our current family doctor actually communicates with my brother, which is really, really cool.
That's amazing. So, it sounds like communication is key. I mean, I think that's
Yes.
probably true for most situations, but especially when you may not be able to communicate as effectively in a way that a doctor is going to then be able to understand and help. It's helpful, it seems, for them to already have a sense that maybe they need to communicate with you in a variety of ways or just be prepared to be able to present information in a variety of ways.
Yes.
That's awesome. So, what would you say have made some of your experiences good experiences?
Well, definitely the communication, um, and actually always taking things seriously. Like both of my family doctors have always been like, okay, I think it's this, but on the off chance it's this more serious thing, going to treat it like this for now, but test for the more serious thing just to rule it out, instead of just treating it like the thing and being like, yeah, nah, it's not the more serious thing. It can't be. Because I've definitely heard stories of that happening. I think it's really important to treat things like they could be super serious, especially for those of us who might not physically represent or like be able to communicate the symptoms in the same way. Because if it is the more serious thing and you just rule it out because it doesn't seem the same, it could end up really bad in the long run. And so always ruling out the serious thing, I think, is really important. And I've really appreciated that from my doctors.
So we know that a lot of people are anxious about going for doctor's visits, and so oftentimes they just won't, because they have, fears over. It could be in any number of things, but typically autistic people don't tend to have the best healthcare experiences. So, it could be for a variety of things. We don't know what's wrong. We don't know if we should go, but in general, the moments where we know we should go and we don't, there's some sort of fear or discomfort associated with those experiences. And as much as it's great to be able to have the doctor understand, if you have a doctor that maybe isn't as understanding, is there anything that you would recommend people can do to make the visit easier for yourself? Like, is there something that the patient can maybe do to make it easier for themselves?
Uh, well, for my first visit to any new doctor, I've definitely had some bad experiences with like specialists. So for my first visit to any doctor, because I've definitely had some bad experiences with like when I've had to go see a specialist or things like that. I always like to bring somebody with me if I can, somebody who's very comforting for me. And if I have trouble standing up to the doctor, they'll do it for me. Uh, so if you have somebody like that in your life, that's really important. That does it for this episode of The Pulse. We want to share more stories and ideas for easier office visits. Let us know your ideas in the comments. And, as always, if you have topic ideas or if you want to be a guest on the show, send an email to voa@pacificautismfamily.com. We look forward to meeting you. Don't forget to like, share, and subscribe. Thanks for listening. We'll see you next time.